Hey, everybody, welcome back to the Dr. Greg Jones Optimization Academy, where I get to interview some of my favorite innovators in health and wellness and regenerative medicine and functional medicine and all these really cool things and just have good conversations with good practitioners, right? And today we are super excited to welcome back Lexi Yoo. For those who did not listen to part one, stop what you're doing, listen to part one, then come right back and get to part two and learn about Lexi. She is the founder and owner of Yoo Direct Health, a leading healthcare practice that focuses on integrative medicine, anti-aging, and bioidentical hormone replacement therapy. She is a double board certified nurse practitioner, not single board, double board. So that's extra work. So that right there should let you know she is a serious practitioner in the areas of family and pediatric medicine with a passion for providing comprehensive and personalized care to her patients. Lexi is a dedicated healthcare professional, and she strives to make a positive impact on her patients' lives, delivering personalized care that addresses their unique needs and concerns. Through her Yoo Direct Health and YDH training academy, she pushes the boundaries of healthcare innovation, empowering others in the field to achieve excellence in patient care and well-being. Welcome back to the show, Lexi.
So good to be back.
Man, I need to get something like an applause thing, man. Like I hit a button and some applause. You need that though. You
Sound
deserve
effects.
all sound effects, right? I did find some effects on it won't do it, but I was on a YouTube and I was doing like a thumbs up and it was like the stuff was popping up, balloons were popping up, and like I totally
Yeah.
lost my focus, but I got my focus back today. So we are going to talk about some really cool stuff today. We're going to talk about wound healing and skin healing, right? Because again, this ain't about band-aids. This ain't about rubbing some ointment on it. This is about actual healing and getting better. So I'm super excited to talk to you about that today. So I'm going to get right into it because we've been waiting like 2 whole weeks for part two. So we're going to jump right into it. So what are some of the most common, because when you think wounds, right, most people, you think wounds, you think, oh, I got stabbed. I cut myself like on a paper cut, which are the worst cuts ever, right? That just makes you want to realize you want to rethink your religion and get a bad paper cut, right? Or just something like that. What are the most common wound cases you actually see in practice?
We have like the full gamut of patients. So as far as wound goes, we have patients where maybe we do a lot of women's health. So the mommy makeover. So we've got the under boob scar. We've got the transverse abdominoplasty scar. We see a lot of that. We have patients who have MSK procedures. So musculoskeletal, so shoulder, knee, anything like that. There's scars in that kind of form that we also deal with. The other thing that's been pretty cool is my medical director, so in Indiana, we have to have a collaborating physician. Our medical director is a cosmetic surgeon. So in his previous profession, he also did a fair amount of wound care. So just kind of learning a little bit through just the other modalities that you can use, hyperbaric oxygen and things like that, has been really cool. So for the sake of my practice, I do a lot of acne scar treatments. I do post-operative type scar treatments. And then the other thing that I would say that we do see a fair amount of is like pigmentation. So it's not technically a scar, but it is something that does benefit from the types of treatments that we offer to our patients. So that's probably the variety of scarring that we do.
Do you ever get to treat any burns? I know most times you get a bad burn, you're going to the ER, urgent care, but do you see anyone kind of recovering from that?
I have actually treated some burns, but the burn was like 10 years ago, and I have like the leftover kind of fibrous skin that you can definitely see has some texture changes and pigment changes as well, but not like fresh burns. No.
Yeah, I think here, kind of the ones that I've seen, I don't know if we call it a wound, but it's sometimes you'll see like that post C-section scarring, just trying to get that smooth again. And we're going to talk more about these things a little bit later. But for the most part, when people have wounds, they're generally going to, for what we do, you cut yourself and it's bleeding. I'm pretty much gonna say, hey, it's great. I'm glad you told me that. Now take your ass to the ER. Like seriously, right? You need some stitching. Somebody got to sew that up, right? So there's a level of what we're doing. But I think for us, it's actually getting those wounds to heal after they kind of got the initial kind of trauma unit kind of stuff going on, right? So you've kind of been triaged, and now you're at a point where you want this scar to kind of go away, right? And I think that's where we're seeing a lot of it. So now that being said, like let's just say you get this this wound patient, this skin healing patient, is we were kind of talking about, like, we never just, last episode, we never just jump into let's do this. Now, when it comes to wound healing and skin healing, what are some of the foundations you want to make sure that are set in your patients before you dive into some of these more cutting edge innovative therapies?
Yeah, absolutely. So one of the biggest things that we would see, especially, so my background is I was a peds general surgery nurse practitioner in a pediatric hospital, right? So that is surgery at its finest. I would say nutrition, right? So a lot of things that we would look at is, are they, with pediatrics, they don't really have a choice. It's kind of like whatever their parents give them. But the things to kind of keep in mind are gut health, right? So what is their microbiome looking like? Could that be a reason of delayed wound healing? Thinking about things like a candida infection. So candida, if you do anything with gut health and functional medicine and the 5R approach to gut health, clearing candida can be very difficult. So sometimes if we see a wound that is maybe delayed in healing, or if they continue to kind of get this reinfection, you want to start looking at, do they have dysbiosis, or do they have an insufficiency dysbiosis, meaning do they lack the beneficial bacteria in the gut to help support their immune system? 80% of the immune system is made in the gut. So if our goal is to recover, repair, build that collagen, that's what causes a scar, is the rebuild of collagen and elasticity, and the microbiome is not good. We got to start there. I would say some of the other things to consider would be, as we all know, semaglutide is such a popular peptide. I feel like that's when people say peptides, automatically they think of that one. But looking at, are they diabetic? Are they pre-diabetic? Are they insulin resistant? Again, because that is going to delay wound healing if they are. Hydration status, that can also be another thing. Another thing would be maybe like their thyroid status. So a low functioning thyroid can oftentimes lead to a delayed wound healing as well. Other things to consider would be like mitochondrial dysfunction. So what is their mitochondrial looking like? And the thing is there's not like, here's your one mitochondrial test, like a pregnancy test. You pee on the sick, oh, you're pregnant. There's not a test like that for mitochondria, right? And that's where really functional medicine kind of shines. It's a constellation. It's the clinical picture. It's looking at lab values. And then how does it present? So when we think mitochondrial dysfunction, we look at things like maybe glutathione levels, or like a GGT. Are they iron overload? Are they sarcopenic? We look at all these things because those could be the root causes, is why are they having a hard time healing. So we look at all these other things to kind of help set the landscape for a good ecosystem of healing, and making sure we're really supporting their immune system, making sure they're supporting their gut health. And not only that, controlling inflammation, which, as we all know, inflammation can be such a trigger to other things, right?
Huge. It's huge, right? Now, what's interesting about that is one of the things we ask our patients when they're kind of in this healing pathway, and this doesn't matter if it's a wound healing or like an injury, is, when have you been taking any steroids, right? Especially the glucocorticosteroids, right? Or so the glucocorticoids, right? So that's your prednisone, right? Because again, prednisone, usually if there's inflammation, a lot of times in the more traditional healthcare surroundings, that's their go-to. You got some inflammation, here's some prednisone, right? You got something going on in that pathway, prednisone, but that prednisone actually can suppress the long-term healing pathways, right? So that's one of the things. If someone comes in, hey, you hit it right on the head, like, how's your diet, how's your gut, but also, have you been taking any steroids? Has this happened? Because now that's something we have to take into account, even though, yes, it suppresses inflammation, but a little bit too much, right? Sometimes you do need that inflammation to get the healing process going. One of the gut ones I was actually looking at really cool is, again, I think we talked about it last time I saw you, is like the GI mapping. I believe you guys do a pretty good amount of GI maps, right? Is one of the bacteria that's kind of like the good guys in the gut, right? That I was like, oh, okay, I think about it for weight loss, but Akkermansia, there's some studies that show that Akkermansia has a effect on actually healing and supporting the healing process, right? Just not a typical probiotic, right? When people go get the probiotics, they're getting bacilli and all that good stuff. But have you guys worked with Akkermansia at all? Or?
Absolutely. There's a wonderful supplement by a company called Pendulum, and we will use a lot actually in our GI map protocol, because Akkermansia can help increase your natural production of GLP-1. So if I have a patient and they're metabolically fragile, and what I mean by that is they have trouble losing weight, they're constipated, they're not getting enough water, they're maybe pre-diabetic, their insulin is maybe over 10, like you're metabolically fragile. Yeah, it would be a great option for that. And then not only that, tributary is great because it'll feed the short chain fatty acids, which short chain fatty acids in particular can help metabolically improve the bacterium to help kind of digest those carbohydrates and break those down and absorb them appropriately.
Awesome. Awesome. Now you mentioned diet. Are there any particular kind of diet recommendations you want to have in the wound healing or the healing process, whether it be like protein or carb intake?
I would definitely say making sure that patients are getting enough protein, not just for wound healing, but for mitochondrial function, promoting lean body mass, because that's going to help kind of promote their immune system and aging and all those things. So definitely making sure that they're getting enough protein, looking at things like vitamin C and zinc, and like endogenously supporting that as well. The other thing to consider too, especially in a patient who might be a little bit older, especially in our practice, we do a lot of hormone, and I know you guys do a lot of men's health, is are they having erectile issues? Because then in my mind, that tells me cardiovascular wise, there's some issue. There's probably some nitric oxide situation that's probably not great. So that's where I go into thinking, how can we endogenously help support that? Looking at things like CoQ10 levels, maybe putting them on some sort of like an arterial cell that kind of help improve the natural production of nitric oxide and improving the glycolysis of the cell. Other things, and that's kind of where IV ozone can really kind of help, is that you're going to help improve some of that oxidative stress in the body to get the inflammation down.
Awesome. Awesome. Now, there's all that really cool stuff, and protein's so big though, and we haven't, maybe I'm going to have you back on the podcast and we'll definitely talk more about, I just want to do more myth busting on the GLP-1s, right? And there's the big myth of like, you get on these peptides and lose all this muscle and blah, and especially like your athletic patients. Once they hear that, it is all stop. Like, look, we ain't got to talk about it no more. You're talking about losing muscle. I'm not about that life. Don't want it, right? And that education piece about, we just don't eat enough protein, right? Most people don't. And especially as we get older, we need more, right? As you love pointing out, I'm an old man and I need more protein, right?
It's only because you're terrible at IT and electronics. That's the only reason I even thought that.
I'm horrible at the new stuff, right? The old stuff, your boy got it down, right? You need me to hook up some dial-up internet for you. You just make the phone call and we got you over here. But you start talking that fiber optics, then I'm just like, how it goes. But now you got your patient in, you've seen them. Hey, we went over their foundations. Hey, we're making sure you're eating correctly, all this stuff, right? But again, now the foundation is important. You can, like we talked about before, you can do it in conjunction, in parallel. Sometimes you got to do some things first. But now you got this patient, we're ready to start healing those wounds. Like, let's kind of talk through like the toolkit, right? What are some of the things in your toolbox to accelerate and improve wound healing?
Yeah, absolutely. So think about, I know you do a lot of musculoskeletal type injections, PRP, right? So PRP is only as good as what the patient is going to be. So setting up the milieu or the landscape, nutrition, optimization, good nutraceuticals, making sure their microbiome is important, helps that PRP be much, much more valuable to the patient. I always say you can't put shitty gas into a car and expect it to run well, right? It's not going to. That's a big reason why setting up that landscape, especially if you're going to be using like a PRP product, platelet-rich plasma, platelet-rich fibrin, any kind of personal stuff, you definitely want to make sure that those things are up to snuff and running. I would say some of the other kind of basic kind of tools that we have, there's a couple different ways we can go about it, depending on what kind of wound that we're treating. I would say most recently, I just presented this past weekend on some of the acne scars. So when people have acne and they have that residual pocking, so pocking is where there's like an indentation of where maybe there was some sort of papule or like they picked at it and now it's scarred. So there's a couple different things that we can do with it. I actually have really come to love neural therapy. So neural is Neural, neurotherapy. So that's where you use Procaine. If you don't know what that is, I didn't know what it was until like February, and I've been a nurse practitioner for almost 13 years. I'm like, what is this? And how did I not know about it? But what's kind of cool about neurotherapy, as I'm sure is that it's not only great as an anesthetic when I'm actually doing some of these pretty aggressive procedures, but it's also therapeutic in nature, which is great. So one of the things that I like to do, especially for acne scars, and not only acne scars, but the actual scars on different areas of the body, is I will inject Procaine as kind of like my local anesthetic, kind of give it like a little bit of a block, but then I will take a longer needle and I excise the scar. And what I'm doing is it's a manual manipulation of where I'm breaking down those little fibrous bands. That is what's causing that healing ridge to kind of harden a little bit. So you're getting the pharmacologic therapeutic benefit, but then you're also getting the manual benefit from it. So it's kind of like you're getting the best of both worlds, which is great. Pairing that also, so I'll inject Procaine, and then I can also use use a microneedling pen. So microneedling is a great way where it looks like a little pen and it's got 5 little 33 gauge needles at the end of it. And I've used a couple different pens. I've used Rejuva pen, I've used Skin pen is the most recent one that I've used. And they're great. What they do, and you're definitely going to want to numb this, but you're going to basically create these little micro traumas or these traumas to the wound. And what that's going to do, it's going to trigger the healing cascade. So it's going to help your body kind of endogenously create this little collagen formation to kind of help accelerate that wound healing. And out of that, basically re-repair it. So I've broken up the scar tissue with manual manipulation and Procaine. Then I've kind of taken a microneedling pen over a wound. Then what I'm going to do, I might use PRP. I might use growth factors. That might be a donated type growth factor. And I'll inject that because that's going to help the wound healing process. Then I'm going to hit it with some peptides. So the peptides that I'm going to do, and this can be like an injection or this can be a top peptide. And I will pair a lot of the peptides that we talked about in the first podcast in the same kind of mixture. So that first one's going to be that GHKCU copper, and that copper kind of ingredient in there is, I feel like, kind of like maybe the secret sauce a little bit. It helps with accelerating the wound healing, and it also helps increase some of that natural kind of collagen production that you're going to get with the tripeptide of the GHK part of it. I always say, like, you can't have GHK without the copper. You can't have peanut butter without the jelly kind of thing. And they have to work synergistically together. The cool thing about that peptide in particular is it can also become in like a cream or a serum. We talked about burns. I actually have a little jar of it at home because I've got kids. If someone's got a bug bite, a burn, an owie, anything, I put GHK copper with BPC 157 topically. And that works really, really well. So their at-home homework is to rub this ointment on their wound until the next time I see them. A lot of times I will also inject thymosin beta-4, which we know increases nitric oxide, right? So that increases blood flow to the area. You increase the blood flow to the area and you're kind of getting all that healing cascade and increasing basically the healing process of it. I find that I call it the peptide trio: GHKCU copper, BPC 157, and TB4 injected into the wound works very, very well. And that's why I say using that Procaine first is great, because GHKCU kind of burns a little bit. So that kind of helps with that kind of aftermath. Then to kind of top it all off, just add more layers to it, is then I take 20 gamma of ozone and I inject that 20 gamma of ozone right into the wound, kind of just doing like little sub-Q injections of it. And then I take that ointment and I just rub it right on over it. And then that's pretty much kind of the wound protocol that I do. And we've seen amazing success with it.
And that's pretty badass, to be honest with you, because there's a lot of things that we use too. And you hit those are my big three. I actually had in my show notes like, what are my top three? And then we didn't talk about this in advance. They're literally the same ones that I like to use on that. So the GHK copper, the BPC 157, the thymosin beta-4. Amazing with healing, but something Lexi said that to keep in mind is that one of the big parts about healing is the body wants to heal, and it needs to get those healing growth factors, all those your own stem cells. They got to get to the site. But unfortunately, when there is an injury, when there's a wound, you kind of get this remodeling a little bit. You just don't get the flow. Right. So these peptides actually, it's called VEGF, or vascular endothelial growth factor, actually allows creating those new blood vessels to get the nutrients to the system that the body needs to heal, which is really, really cool. And the ozone is awesome because now you're actually getting that oxygen there and also getting more fibroblasts and more of that VEGF. So these are all really, really cool. The other peptide I would consider, it depends on if it's an inflammatory kind of topical site. I'll use KPV sometimes too, a tripeptide. Yeah. So have some really good results with KPV, and even using that in acne too, because it's such a good anti-inflammatory. We've actually injected KPV directly into cystic acne wounds and seen them improve, right? So there's so many amazing options. With the ozone, you mentioned kind of doing the 20 gamma into the scar, which I've also had some experience doing before, especially like post C-section scars. Would you ever consider doing IV ozone as part of the healing protocol as well?
Absolutely. A lot of these therapies can be pricey, unfortunately. If their pocketbook allows, absolutely. If they could do the IV ozone, 1000%. We actually kind of do a stepwise approach. So there's a certain kind of gamma we start them at, and then we kind of jump to the next level, because what I'm trying to do is I'm trying to avoid a Herxheimer response, especially if I've not done a GI map on them. I don't know what their microbiome looks like, and there could be some bad shit in there. We do kind of like a stepwise approach. And then once we get them to high dose ozone, the greatest thing, and I'm not sure what dosing you guys are using at your practice, but the way that I kind of make it very simple for patients is that 1 high dose ozone is the equivalent to 2.5 standard treatments. So what's great about that is that you could basically typically do one treatment, maybe every other week or every third week. And that would be almost as if you were getting IV standard ozone every single week. You're going to see a dramatic acceleration of that recovery by adding that layer of IV ozone on with it, which is so, so cool. Some other things with the ozone that you can also do, we've not done it, but limb bagging. I'm not sure if you've done anything with limb bagging. So that's like it looks like a kind of like a saran wrap plastic wrap. And so you'll put the limb in there and then you basically infuse the ozone into the air, kind of wherever the limb is. Now I'm going to tell you, Greg, my son, he's about to start wrestling season here. And we all know wrestlers love them some ringworm, love them some impetigo. So stay tuned because I might have some limb bag before and afters on that one. One other thing that we've actually used ozone for is there's an extension you can get for your equipment where you have like a it looks like a stethoscope, and you can use it for otitis externa, otitis media, and so we have a patient utilizing it for Meniere's and vertigo for that as well. So ozone's so cool because there's very little, if any, side effects with it other than it kind of stinks a little bit, and it works so well for so many things.
Oh, amazing. So a lot of options and a lot of really cool things to do. And the great thing about getting with a doctor like that's trained in this and a practitioner like Lexi is having those options, right? And finding a protocol that meets you where you are, right? Because I know she just laid out a bunch of stuff, but everybody doesn't need them all, right? And she hit some of the factors: severity, time, because some of the things do take time, right? And also budget, right? Because like you have to kind of get the most effective thing, and then sometimes you don't need it all, right? So it can be a little bit of overkill, right? So I know we all want to do it all, but finding out and getting with someone smart who knows the right things to do. My camera there we go. Sorry, just got a little camera issue there. I'm back.
So Greg, one other thing I wanted to mention here, because we're talking about wounds, and I know for like a week, maybe you were an injector, and then I think you decided to like bow out of that, which is probably for the best. But anyway,
I did society a favor there, right? So it's heroic in my defeat. Go ahead.
But one thing that's actually really interesting. So as an injector, as a trainer, I train for companies and things like that. One of the scariest things that can happen with filler is something called a vascular occlusion, right? So that is where hyaluronic acid or whatever the product that you're injecting either can cause a vascular occlusion where you've accidentally injected it into an artery, and that is going to prevent blood flow and it's going to cause a vascular compromise to other places of the face or wherever you're injecting. Or you can actually get something called the compression occlusion, which is where maybe there's some swelling and you've clamped down on that flow, right? So what's so interesting is that in a vascular occlusion, we can actually use ozone, which is so, so cool. I've been very fortunate. I've not had to use it. I have used it post-COVID, we're seeing a lot of weird shit in the aesthetic world, but we're seeing a lot of issues with something called a delayed onset nodule. So this is maybe some filler that created a little biofilm around it, right? And then here we are, 6 months, a year later, and now they've got like a nodule in their face or a granuloma. I've had 2 cases where I'm very fortunate. We have an ultrasound machine that I can like localize it under imaging, and I've actually injected ozone around it, and it's dissolved, which is crazy. It's so, so crazy because there's no literature on it. I'm like, well, I know it's not going to hurt the patient. I went in there, visualized it, took a cannula, used I used a tiny bit of Kenalog, and then I just kind of bathed the area with a little bit of ozone, and it's incredible. It's so, so incredible. So it's cool. There's so many usages for it, especially in aesthetics, that I don't think the aesthetic world knows anything about.
That's okay. Well, you will be someone at the forefront and educating these people, because I know you're blessed to speak at conferences, and have people come train with you. So the more, the better. All right. I think some people are ready to come get some wounds healed with you, right? I think they're ready. I think they're ready to make that trip and all that good stuff. So no, this has been great and it's been fun. And I'm excited that I'm really grateful and thankful we had an opportunity to circle back and do part 2 on this as well. So before we get out of here, to summarize, wounds come in different shapes and sizes and flavors. Number 1, like Lexi talked about, it's never just a one, hey, you have this wound or you have this skin damage, just do this thing. It's a comprehensive approach, a foundational approach, integrative approach, right? Nutrition, diet, getting enough sleep, all the good stuff. We can go on and on and on, but it's the same factors we always talk about: stress, right? The gut health, et cetera, et cetera. And just getting a good foundation. But there are some really cool things out there between peptides and ozone and PRP and growth factors. So never just throw some prednisone at it as the answer. We want you to heal and continue healing throughout the process. So that being said, another great one, Lexi, another good one. I want to thank you again. Before we let you go and back to changing lives out there in Indiana, where can people find you?
So my Instagram handle is Yoo Direct Health _aesthetics, and it's the U is spelled YOO, Direct Health _aesthetics. My training academy is ydhacademy.com. If you're in Indiana or the Midwest and you want to be a patient, it's www.yoodirecthealth.com. I also have a podcast, which Greg is going to be on at some point when our lives slow down, which they're never going to, Greg. They're just not. The Better You Project. I think that's it.
Well, great. Well, we are honored to have you back on the show. We're looking forward to next time, and I will definitely be on the lookout for that invite to be a guest. I will make it happen. We will do this. We will do it. So, hey, everybody, you have been listening to another episode of the Dr. Greg Jones Optimization Academy. Be on the lookout for our next episode. I want to thank you all for being listeners and supporting what we do here, and I can't wait to see you again.